Hello all, this is Dr. Shilpi Reddy and I am talking about female sexual dysfunction. And one of the very important cause that I really wanted to talk, other than the hormonal causes, other than the phase of life causes, other than the issues that usually medically related like drugs and medical conditions that call female sexual dysfunction, there is a very important factor that I really wanted to discuss in detail and separately as a cause of female sexual dysfunction, which is or are the psychological and social causes. When it comes to psychological and social causes, untreated anxieties, untreated depressions are the major reasons behind female sexual dysfunction. You are not able to get to a solution for a problem. It actually impacts the sexual drive and sexual activity. And whenever women go through long durations of stress and sexual abuse or worries because of pregnancy, because of childbirth, because of childcare, new mother responsibilities, and postpartum blues and all these things, these are one of the kind of a very strong psychological and psychosocial factors behind the female sexual dysfunction. And long-standing conflicts with the partner also can be one of the draining reasons for non-compliance issues and also female sexual dysfunction. And a strained relationship can never lead to a very good healthy sexual relationship. It's like giving a blow to whatever that is already present as a withdrawal form to the sexual desire in women. It leads to a complex phenomena of female sexual dysfunction. And when there are difference of opinion, when there is a difference of thought, when there is a difference of thoughts between two people, again it leads to sexual dysfunctions, be it a dysfunction of arousal, be it a dysfunction of desire, or be it a dysfunction of orgasm. So any differences between the couples in terms of thoughts, in terms of process of thinking, in terms of combined giving solutions, all these things decrease the sexual responsiveness. Whenever there is decrease in sexual responsiveness, it is one of the very important factor and causes of female sexual dysfunction. It can be because of the cultural reasons, it can be because of religious reasons that the issues, they keep on penting up and building up, and that can be one of the causes of female sexual dysfunction. One of the major causes of female sexual dysfunction in the current scenario, which has impacted the psychosocial and the thought process of women, is about the body shaming issues. When it comes to image issues, women do think that if they are obese, if they are of the darker skin types, if they are not looking good, they always talk to themselves and they think that they are less desired for. And again, they have a complex phenomena of sexual dysfunction running in them. But the act of sexuality, the act of sex and the act of sexual activity is irrespective of what you look like, because beauty is definitely on the eye of the beholder. And instantly what I have found out is women, even with very good sexuality, at times withdraw and get into the aspect of female sexual dysfunction, especially because of body image issues. And to get them out of that body image issues and the thought process is it's very difficult. And whenever we deal with such difficulties, it is more of counseling process, it is more of orientation of their thoughts that is actually killing the aspect of their needs. And female sexual dysfunction is more deeper in such situations than actually what we think about. And psychological and social causes are actually one of the toughest ones to deal with, because if the reason is because of any ill health or any medications, you can obviously deal with that and take a cure for it, or change the medication, or treat the depression and all these things. But for some reasons like psychological and social causes, definitely it is more than counseling that works rather than therapy. And there are so many alternative therapies in such situations that actually are used for treatment of female sexual dysfunction or FSD.